Meet Adam and Rose. Adam is proudly employed by a Minnesota public employer, and Rose is now retired after spending a lifetime working hard for her money. But like many other Minnesotans, the rising cost of healthcare expenses is making it increasingly more difficult for Rose to save for her future. But good news! When Rose was working, her Minnesota public employer offered a convenient way for her to save money to pay for post-retirement medical expenses. This tax-free solution is called the Healthcare Savings Plan, also known as the HCSP. The HCSP allows employees like Adam to invest money in a medical savings account while employed by a Minnesota public employer. The HCSP is a tax-free account, meaning that employees don't pay income taxes on contributions, reimbursements, or potential investment gains. The HCSP reimburses medical expenses that occur after an employee separates from Minnesota public employment, retires, or begins collecting a disability benefit from a Minnesota public pension plan. Medical expenses can be incurred by the participant, spouse, legal tax dependents, or adult children up to their 26th birthday. Eligible expenses include insurance premiums, copays, deductibles, and much more. Participating in the HCSP is mandatory if the employer or bargaining unit has adopted the plan. Under certain limited conditions, employees may be eligible to opt out of the plan. Contributions to the HCSP are automatically invested in the default investment option. Once the account is established, participants have the freedom to choose an investment mix that meets their individual needs. Quarterly statements keep participants informed of the status of their account balance, contributions to the plan, rate of return, and fees. To request a reimbursement, the participant must complete a reimbursement request form and provide MSRS with documentation of the medical expense. Reimbursements are always paid to the participant, not to the provider. Upon the participant's death, any remaining account balance will transfer to an HCSP account for a survivor or beneficiary in this order: spouse, legal tax dependents, or named beneficiary. Adam understands that paying for healthcare may be one of his largest expenses after leaving employment. But he now knows the tax-free dollars in the HCSP can help pay for those costs, allowing his hard-earned savings to last longer. Contact the Minnesota State Retirement System for more details about the Healthcare Savings Plan.